Thank you everybody for attending our HVL Venture Lab podcast. This is Jamin Park. I'm the managing partner. Here we have Dr. Pauline Del Mundo, who is dialing in from the US today. Hello, Pauline. How are you?
I'm good. Great to be here with you, Dr. Park, and thank you so much for the invitation to be at your podcast.
Hey, sure. So, Pauline, I looked at your background. I mean, you have a very fascinating background. You have a medical background yourself, but you also went to study public health in Johns Hopkins, and then you also worked in UP. I see that you also with the Philippine Society of Public Health Physicians, and
Mhm.
you also right now back in the US with the Institute of Health Metrics. Would you mind sharing a little bit about yourself? Yeah.
My journey has been a little roundabout. I've been doing medicine for quite some time, doing occupational health, and realizing how there is a lot of intervention that we could prevent using more data. So I went with a strong interest towards uh, health informatics, and I wanted to always gather data together and make something out of it that will lead into further larger scale action. So that's why I went into uh, public health. And my journey from public health came from the University of the Philippines. I worked with Dr. Portia Marcelo, who has been critical with teaching me all the ropes of Philippine public health. And we worked in the National Telehealth Center and learned about medical certification of causes of death and improving data across medical schools. After that, I went to the US because my partner, whom I met during medical school, has his family in the US, and it took a little dilly-dallying. Finally decided, oh, we're gonna go and head over to the US and start our family. And then going to the US, I figured, oh, what am I going to do? I want to continue public health. So I applied to Johns Hopkins and was accepted. I truly enjoyed my Master of Public Health, and I decided to focus on epidemiology and biostatistics and public health economics. And I thought that that combination gave me a more robust foundation in data analysis. Uh, and after that, I worked at the Institute of Health Metrics, where my boss in Jakarta has been truly helpful towards teaching me uh, the nuances of commercial uses of SQL and Python and R. So it just gets deeper from there. And now I'm starting to look more into how AI is affecting all of this. And here we are.
Wow. Yeah, thank you very much for sharing your background. Yeah, I mean, I think the journey really, I think, is you started from the Philippines, UP College of Public Health, right? And now you went to the US and now applying the same knowledge in the US. And at the same time, now you're seeing the change of AI. Just right timing. Imagine if you moved to US, let's say 5 years ago, then obviously then AI wasn't there at the time, right? So yeah, okay. So maybe we will start with Philippines. And then I think we'll go into the US and global and then go into what kind of things you're working on and where you see the opportunities. What kind of challenges do you see in the did you see in the Philippines? Yeah.
There's a lot of challenges in the Philippines, but close to my heart has always been data. So I've worked with public hospitals, private hospitals, and there's always some form of um, paper records there. And it's a large amount of cognitive load, just putting together all of the histories of different patients um, in different formats, in different stacks of papers that you're going to find in the medical records section. And I always wanted to address that. In the Philippines, you would have to retrieve those records and then request it, waiting for several days for your medical records to come back. So we always just end up asking the patient again their histories, and the patient may or may not forget, oh, I forgot this medication that has actually an important drug interaction that you would have to take note of. And then, in contrast, other hospitals in the Philippines have a more robust EMR system. You can bring your laptop and see all of the histories put together by the different clinicians, and then it becomes bloat. People start copy pasting at a certain point, and then you start filtering through all of that and realizing, oh, what is the most important piece of information here? So we have two different scenarios, but the same issue is that there's a lot of documentation burden. So I guess that fragmentation is something that we can address. A little bit more unification of these records and standardization of these records is important. And we have seen some progress so far on that. University of the Philippines has had a lot of efforts towards FHIR integration, as well as using the standards that such as ICD-10 and RXORM that is in progress as of the moment, but there's a lot of work to be done.
What kind of I mean, what hospitals does your UP work involve? I mean, there are different types of hospitals, right? I mean, obviously St. Luke's will have like a really like a up-to-date system. While if you go to PGH, obviously it's going to be very different. Yeah. So what kind of hospitals did you work with?
Um, I we did integrations with some of the rural health centers, and that was I think 2022. Our team was working on RX box at the time, getting integrations of prenatal care. So this was community centers, um, small health centers as well. And it does have a lot of work to be done. I believe that there is a lot of progress over the past years that since I've been there as well. So hopefully, when I come back, there's a lot of integrations as well with FHIR and other electronic medical records.
What do you mean? What do you mean by FHIR?
Oh, FHIR is FHIR.
I missed you.
It's
What do you mean by
so
FHIR?
FHIR. So it's a standard created by HL7, and it's a standard for exchanging healthcare information electronically. And UP is working on all of these integrations. However, it takes a lot of buy-in from hospital administrators to be able to create and put those in place. So I'm seeing from a distance how this has been progressing, and I'm excited to see what they're going to do next.
Why the hospital administrators? What's keeping them from integrating these technologies or the standards?
It's a lot of onboarding. It's a lot of human resources that are necessary. Some hospitals may need greater infrastructure, computers, coming from paper, that's a large lift.
Hmm.
And of course, the investment, the monetary investment and buy-in of all of the board members of any facility is important. So with all of these additional people trying to sell EMRs as well, there's going to be a vetting process. Which one is the best one, the most cost-effective one that they can use in the long term with good maintenance? So these are all the different considerations that you're going to look at.
Well, what kind of EMRs did you see in Philippines when you were there?
Back then, I've seen BizBox, I
This
believe.
box. Okay.
I've also worked with Serious MD on a personal level, not with any other organizations. That was also very helpful because I appreciated their prescriptions and drug interactions
Hmm.
checker. So that was helpful for me. Uh, yeah, so those two I'm more familiar with.
Okay. How do you, I mean, now that you're in the US, right? Like how do
Mhm.
you, like, you probably see all kinds of platforms now. So what do you think about, like, what you've seen so far and what you see in the US, right? Where are the gaps and what could be improved?
So I've seen Epic, and that was actually very good. You can customize it based on the hospital's needs. It's very variable depending on the hospital, and you can request certain features that may or may not be present in one hospital or another. However, there's still a lot of fragmentation because Epic is not the major, it's not the major, actually, Epic is the major EMR of the
Right.
US.
Right.
However, it doesn't have the entire market share.
Of course, of
So
course.
there's still integrations, there's still differences in transporting one data record to another. Meditech, for example, exists in our ecosystem as well, and then you'll have to send over some data, and there's still a little bit of kinks in transmission between those two records.
So, yes, signals are having some trouble. Okay. So why not just bring some solution from overseas instead of trying to rebuild their own? Why are they doing that? Isn't that kind of like repetitive effort?
You mean from the US?
Yeah, US or other country. I mean, there's so many. I mean, like I've seen EMRs and EHRs and US, Singapore, Korea. I mean, there's so many other countries who already have some of their own. So why don't they just bring something and just set it up there instead of trying to build something from scratch? Why are they doing that?
Well, people want to have their own thing going, I believe, and they want
Yeah, isn't that
people.
kind of a counterproductive? Like,
Yes.
okay.
Uh, yes. It's nice that there are people who actually do try to collaborate and say, oh, this is going to be the open source standard.
Hmm.
And then when they say that this is the open source standard, this is going to be the established standard,
Hmm.
it's going to be more widespread. So HL7 has been working on that. And that reduces the amount of redundant effort internationally. And that requires a lot of coordination as well.
Yeah.
And that in itself is a whole other challenge.
So, when you went to the US, right? So moving from Philippines to the US, what kind of challenges did you see in the US health records or the US? I mean US healthcare, but I mean that's too broad, right? So maybe how about like within this lane, what did you see the problem that was in the US that we don't see in the Philippines?
Healthcare costs are insane to say the least
Of
in
course.
the US.
Yes,
In
yes,
the
yes.
US.
Yeah.
So there is a lot of uh, there's a lot of costs related to insurance.
Hmm.
The regular US customer needs to get insurance premiums,
Hmm.
pay for insurance premiums every month. And even then, they still need to pay out of pocket
Hmm.
in addition to whatever additional thing that the
Yeah.
hospital
But
decides
but
to
this
add
is
on.
more on the health like the financing, right? But
Mhm.
how about in the health records? How about the health IT side? You know, which what we
Health
were just talking
IT
about from
side.
Philippines side. I mean the
It,
Philippine US, I mean the purchasing power is obviously going to be very different, right? So how about in the health IT and the medical records data side? What do you see there? Yeah.
for data, it's like there's so much of it. People are creating so many versions of their own data or EMRs.
The same with Philippines.
Yes, it's just larger scale.
Okay, okay.
So it's larger scale because it's a big country. There are more people, there are more records, and they're starting to establish their own thing. Um, in the Philippines, we're starting from paper in a lot of hospitals. So
Hmm.
there's a lot of room for invention and a lot of room for agility and mobility. But when you started from a large institution already and trying to integrate that, and these institutions are saying, oh, I'm the biggest institution here. You need to adjust to my standards. There's a lot of pushback as well. So it's a question of who has the biggest market share, and then others will adjust to that large company. So I think that's how I perceive the US. Um, Opinions are solely mine, of course.
Of course. Okay. So I mean, it sounds actually quite similar to what's going on in the Philippines, actually. It's just in a different level, but same kind of okay. What kind of innovations have you seen in the US that maybe we don't see in the Philippines when it comes to health records? Yeah.
So people have actually seen this issue. They have seen the issue of fragmentation, and there are groups, one of which is Odyssey. It's OHDSI.
Well,
Uh, and they try to create standards to integrate all of these
hmm.
records so that they can create studies for it, they can create research papers for it so that there's use for all the billions of data that patients have.
Hmm.
And I've seen that it's making progress in the US.
Hmm.
It's also making progress in the EU.
Hmm.
And it's looking very promising in terms of what companies can do to study prevalences of disease, the use and safety profiles of certain drugs. So I look forward to seeing what they do next. Hopefully, the Philippines will be able to join in soon and help.
This is some kind of a regulatory consensus among the countries. Is that what it is? It's not a private initiative, right?
It's a nonprofit open source
Okay. Okay.
project.
Hmm.
So similar to FHIR,
Hmm.
people aren't exactly regulating it in a way. It's like a consensual agreement that, oh, this is probably the best standard. And do we just adjust based on the feedback of users over time?
Are there any companies tapping this to commercialize something? No?
Yes. So I see that there are several companies looking for Odyssey slash OMOP tools in their analytics. Say when they post a job post, we're looking for somebody who's using OMOP or Odyssey so that they can start integrating for post-marketing surveillance. I've seen this with some major pharma companies up here in the Northeast.
Okay. Okay. This open source right now, anybody can use it, right? But you have to be trained to use it, I guess.
It does take a bit of learning curve, but all of the resources are open. They have lectures as well, so it's something that other people can get into.
Do you know how to use it?
Barely. I have not delved deep enough into it, but I
Sorry, what?
actually do look forward to using it. I have not delved deeper into using it, but I've only begun in looking at their documentation as well.
But there's something you can just learn online, or do you have to take a class, or how does it work?
You can just learn it online, and they have lectures on it, on how to use it. You can also contribute to their GitHub if you're
How do you
savvy with
find it? How
R
do
or
you find this
Python.
again? How do you find this? Odyssey?
Yes, it's spelled OHDSI.
Ah, okay, okay, understood. Okay. But this is an open software. So I mean, so why don't you
Yeah.
bring this to the Philippines and get everybody to sign up? I mean, use and try to like okay, so I mean, maybe try to like I mean, the guys I mean, when you talk to the regulators here, it's just like I mean, they're like 10 years behind at least, right? Their mentality is like from the I don't know 2010s or before, or if you go to those like rural LGUs, I mean, these people still living on paper, right? But this is open source. You can learn this easily. Like you can just learn this and like get these guys to learn. Yeah, and sometimes I feel like there's a resistance like to learning. Just people just don't want to learn, especially those folks in the 40s to 50s and 60s. I mean, I'm not gonna name, but like some people there in Philippines, especially like if you're like some rural or local guy, you just don't want to change. You want it like the same. So I think maybe that's the resistance. Yeah, that's interesting. This is a international, right? Hello, this is
Mhm.
international, right?
Yes, yes. So we don't have enough of an Asian presence for this one yet.
Okay, okay. Any Asian digital platforms utilizing this right now?
Platforms, you mean EMRs?
EMRs or EHRs? Yeah.
Yes. In a sense, yes. There are. I see IQVIA using this. There are some
IQVIA is
companies
a
like
big,
IQVIA.
yes.
Yes. They offer services to convert EMR data to OMOP data. I've seen that on their website. And I believe Hopkins is also an Odyssey, and their EMR systems are also mapped to that. Columbia is also there,
Hmm.
and several of the academic centers as well. So it's actually a mix. We
Hmm.
see pharma, we see CROs, we see academia here. So and it's a good environment. I actually do hop in quite occasionally and just learn and absorb what they're talking about. They have a lot of research papers going on as well.
Okay. Are you able to like search for something inside, or like is it more like they give you like a published papers, or how does it work?
They have their website at odyssey.org. You can see their GitHub. That's their code base. You can
Okay.
also see their education, and they have this book of Odyssey, which is more like their manual over the past several years that they iterate on. They have their YouTube as well.
Yeah, I'm just looking at the GitHub. Yeah, this I think definitely beyond the lay people's. Wow, okay. Interesting.
I
But yeah,
I do admit there's a bit of a learning curve, and
hmm.
there's a lot of R and Python that you may be delving into, but I find it that it's kind of fascinating that you're doing
So
different projects.
so maybe if you can give me an example. So like I'm new to this, right? So if you can give me an example, let's say how can this be like let's say like how could this be applicable for real world users? Would you mind giving some example how this could look like? Yeah.
So, for example, I have Johns Hopkins and Columbia's database. They
Mm,
want to do a joint study on their populations,
mm,
on the um, effects of GLP-1 after discontinuing um, Ozempic or Wegovy or whichever drug. If they join all of their data together using the standards in Odyssey, then it's possible to do a network study of
mm,
this so that they can have a larger sample size than they normally would have.
mm,
So if you have a large sample size, you get a more robust study that's more representative of the total population, uh, rather than just isolating yourself with just one institution. So we're talking from maybe 2 million people to 5 million people to 10 million people, and that dramatically improves your validity of your study. So
So let's
it's
say if I use this, I mean you're basically able to pull the data, right? But can it what other things can it do besides being able to bring data from different places together?
you can do studies such as cohort studies, observational studies of causal inference that are more robust
Hmm.
rather than just having one study. Uh, Ideally, in the future, you can have identifiers. Say, for example, this patient went to this hospital and then moved to another hospital. So you can tokenize the patient to see, oh, did this patient come from rehab and then got readmitted to the hospital? Or did she or he go from hospice and then was there an emergency after that he went to the ER? And that allows you to trace the patient's journey throughout. That's the ideal, but there's still a lot of work being done for that.
Yeah. So I think I get the concept about the tokenization. So basically, the patient can move from one system to the other, and I guess the process would be more streamlined.
Mhm.
Yeah. Okay. Yeah, I'd love to learn more about this. But I guess we only have 1 hour, so I'll try to go into the other topics. Okay. So I know that you are also working on. You sent me the presentation. I know you're also working on your own platform. Would you mind telling me what it is? Yeah.
Okay, so I've been working with my partner
Mm,
on this website called Informatica,
mm,
and this stems from a personal need to understand our options in terms of careers. And I was thinking about this ever since 2017 when I started Filipino MD. It was a Facebook website where people would post jobs, and it became an 11,000 person doctor group on Facebook where people would just post about their residency openings, their
mm,
job openings.
mm,
However, for me as a user, it's very hard to track where the openings are, whether they're still valid. And it's also difficult to submit my requirements to them because each one requires all of your transcripts, your letters of recommendation from your professors or your seniors. And I saw that in the US, they have this website called ERAS, and you submit all of your documentation, you verify your credentials with them, and then you can submit to up to hundreds of applications to as many residency programs as you desire. In contrast, in the Philippines, you have to apply one at a time to each residency program, and sometimes you do an audition rotation for them for about 2 weeks or 1 month, depending on their policy. And then if you do not get accepted, you repeat the cycle again. And I wanted to address that. And hence, I went and built Informatica with my partner, and we're working on getting hospitals to be able to post their residency openings so that doctors fresh out of medical school or have been moonlighting for a while will be able to apply to the residency programs.
This is so really more for like a hiring or residency selection in process.
Yes.
You know, in the US there is I forgot, okay, I forgot the term for that. There's a, you know, the matching program in the US for residencies,
Yes.
right? I forgot the
Yes,
term. It's
that
like
is ERAS.
yeah.
So
So
that is ERAS.
how come Philippines wasn't able to implement that?
I don't know. That's weird. There is no implementation for residency programs. It's just very fragmented. They post on Facebook. They post a little poster or an ad on a Facebook chat,
Hmm.
which is usually embedded within a Facebook group. And then you have to email or text the people on that image or Facebook ad, and then it's a lot less integrated, so to speak.
I mean, you know, US had this has had this matching program for decades, right? I mean, they've been around for a long time. So, I mean, shouldn't it be something that we can go to Philippine government, DOH, or I don't know whichever the agency that's handling it, and basically ask them, hey guys, uh, you guys should really adopt this because this will make your the residency selection and the hiring process a lot more streamlined. And you know, not to mention the you know they have a doctor manpower shortage, right? I think Secretary Ted, I think last week he was sending off the doctors to the barrio students to their places, right? So imagine something like that, right? So how I don't know. Have you had discussions with the guys in the government here before?
No, actually, we're just about to launch. I just started working on this MVP,
Huh.
and was hoping to like slowly get proof of concept and get the traction needed to see, oh, will this be helpful with the residency programs? And I do believe it's going to be helpful. They do mention that there's been difficulty in getting residents to apply for programs because of the work hours. A residents' work hours is usually around at least 24 hours to 36, depending on the program. And that does prevent some residents from applying. But of course, if you're able to apply to a lot more programs at the same time, then that helps ease the barrier to application as well.
So right now, like you literally have to fill out application for each school and then send it yourself like that. Then
Yes, yes.
obviously that's gonna be a lot of work. That's a lot of work. You know, like
Yes,
I remember when I did my residency for the US, I mean, you know, you can select the programs. So you don't have to like reinvent I mean, this is like I mean, you know, it's just too much effort, right? So it's really like that in the Philippines right now.
yes, yes. And one big pain point that I've also identified is that you cannot you have the difficulty of chasing letters of recommendation. So this is something that is a pain point for many medical students because they will ask one senior, hey, can you write me a letter? And then if the person doesn't push through with one program and then asks for another letter,
Yeah, it's too much work.
it's
Yeah.
yes, it's also awkward for the student. It's like,
Yeah, of
oh,
course.
I didn't push through with this one. Can I ask for another one and then another one?
Wow.
So here, uh, this one will allow you to store your letters of recommendation and forward it as long as
Yeah,
the
they have it in the US.
recommended.
So basically,
Yes.
like even for me, I think I asked for 3 letters, and I asked
Mm,
my the recommenders, hey, can you? I think that you can go to this website and upload and all that, because because actually, I'm not supposed to see it, right? But the system is going to upload it, and then they can verify it, and it can be used instead of a. I
yes.
mean, imagine if I had to go like, oh, sorry, but I have to also. Can you send it to 5, 6, 7, 10 schools? It's like. Yeah, I mean, that's a lot of it's really a lot of work. So that's really what's happening in Philippines.
Yes. And we don't have that mechanism where the recommender can choose to like hide the contents of that letter. Or you don't have the option for the medical student to waive viewing the letter. So the medical student will most likely have to hand deliver a sealed letter from their senior or their consultant and then bring it to that one program.
Okay. Okay. So, what's the next step for you? I mean, I have a better understanding about this. I'm sure it's more than just medical school, like application. But what is the next step for your opportunity? Yeah.
What I'm going to do is to beta test this platform and have several medical students and graduates try it out and
Hmm.
see whether everything works for them, whether they're recommending additional suggestions. And I'll be starting to reach out as well to residency programs to hopefully see, oh, this is going to help you get more applicants over time. It's going to be a soft launch
Hmm.
where we beta test everything before we finally launch everything, hopefully this mid 2026.
So, um, do you already have the beta version, or where is it now?
It's informatica.llc.
Hmm. Like, do you already have this available that we can use, or is it still in the development?
Yes. Uh, Cleaning up a little bit more, but a majority of the features are intact.
Have you already tried this out in any schools or institutions?
No, not yet. It's you'll be the first one outside of the family or friends to know about Informatica.
Okay, thank you. Hey, so I'm just asking. I mean, I just actually asked the one dean of a medical school. Hey, do you guys have a platform like this? I mean, I didn't mention your name or anything. I just kind of asked if there's like online portal. So what they're saying is they have an in-house university admission portal. So how are you gonna try to like sell the value proposition of this? With what I mean, have you seen the admission portal of other
Mm.
universities in the Philippines?
Yes. Yes. So admissions portals are actually the purview of well, their own websites. So I also know that there's such a thing as educacion.ph, also another portal where degree granting universities get applications, but there is no particular platform for residency programs inside hospitals. So hospitals are a different
Ah,
beast.
okay.
They're
So
not,
now you need to go to hospital, not just university.
yes.
Okay,
So for a
understood.
residency program, you need the the consent of the program director of that hospital. Say, for example, you want to apply to that ENT department, you just go to that particular department, and each one doesn't have a unified system.
So, I mean, then the universities, so you can go to a hospital already and ask, hey, can
Mhm.
you try to use? I mean, of course, you want to go to a big hospital, right? You don't
Yes.
want to go to a small hospital where they're only going to hire like 10 people. I mean, then it's like there's no point getting something like this, right? I mean, of course, if it becomes like a regional or like a national level, obviously it makes sense. Um, yeah, I mean, what will be the onboarding cost for something like this? So let's say, let's just say we take you to let's say hypothetically Medical City. I mean, I'm not saying they don't have it, but just hypothetically, Medical City kind of a level of hospital. Then what kind of resources and what kind of what do you need to like onboard it there? Like how much will they cost and what's going to be the timeline and yeah.
This part is still being fleshed out, but we're looking at um, initially a free 6-month timeline for receiving applications, but to verify and to view the verified credentials, that would go around maybe 5,000 a month. We're still looking at the entire market right now, how that's going to go, but
3 to 5,000 what, sorry? Like pesos or
pesos
3 to 5,000 pesos per month for per what? Per institution or per student or
per residency program.
only 3,000 a month for a whole program.
Uh, for just the one program that will hire maybe two people for the residents. So that's usually how it is. Of course, we're still looking at projections on what the actual issue is because we're also going to be charging student side for
Hmm.
storage of their credentials. So storing credentials will also take server consumption and indefinite storage can also also needs a little bit of sustainability. So we're also looking towards uh, credential storage, credential verification as well.
Okay. So I guess there's different features with the different costs that will come with it.
Yes.
Okay. Uh, okay, so the university dean just told me they upload to the admissions portal. So I mean the letter.
Mm.
So they have, I mean, so they have something, I think.
Hmm.
But I guess it's good to see what the okay. I guess I need to ask a hospital person. Let me see if I ask a hospital person. Give me a second. I'll ask him, what do you guys use for residency? Well, how should I say residency platform or what? Like the recruitment.
Residency applications.
Is it online? Is it paper? Etc. Okay, let's see what it says. Yeah, I think this guy's traveling. Let's see what he says. He might not be able to come back in 10 minutes.
Yeah.
Ah, okay, interesting. Yeah. So I think definitely I mean, there is a gap. And if you can take this Informatica to the even at the province level, that'll be really, I think, amazing. Like it will make it easier. How about the government? Do government hospitals also need this?
Uh, I suppose so because I worked in a government hospital during my internship. Um, they also recruit through Facebook and they do the similar style of recruitment as other private hospitals. I ask submissions through online or email or maybe a Google form that that they request, or in-person application with all the documentation as well.
Okay. Yeah, so I just asked the secretary, do you take in government residents? I think he does. Yeah, I don't. Let's see if he again if he can come back in 10 minutes. It'd be interesting. Okay. Yeah, so I didn't know. Yeah, I knew about eras, of course, but I didn't think about it, of course, until today. So yeah, thank you very much for bringing up the topic. Um, yeah, so so let's say if I were you, right? Um, of course, you probably want to. I think I looked at your deck. You probably want to have some like a more detailed business case, but I'm guessing you probably have something like that already, right? But you also probably need at least the one hospital, the pilot, right?
Mhm.
You want to pilot at least one, right? So where are
Yes.
you in that process right now? Yeah.
Um, Pre-launch phase, debugging phase, we'll probably launch probably in the next 3 months
Hmm.
and get hospitals on board just to but we're just making sure that everything's running smooth and hopefully if all the bugs are fixed, make sure that everything's clean.
So let's say you have you looked at other countries in Asia, like what they use,
Um, I
like
believe,
Thailand, Singapore, Vietnam, or
yes,
Korea? Yeah.
uh, I'm looking at Southeast Asia as well.
Hmm.
I think there's some fragmentation in Indonesia and probably Bangladesh. But there's a lot more nuances as well. I have seen a few Facebook groups for medicine in Southeast Asian countries.
Hmm.
So that's also another way to probably reach them.
So they're
And
using a Facebook over there also, or something like this.
yes, but not as much as Filipinos. Filipinos are majority of them are on Facebook.
Oh, okay, okay, okay. So what is what does your next 6 month look like for you?
Uh, I'll be hopefully onboarding a few medical students and maybe at least hopefully 5 or 6 programs
Hmm.
in the first few months. See where that goes. Tweak as I improve on acquisition or outreach. See whether the pricing works
Hmm.
and move forward from there. The business has already been registered as an LLC. Just make sure to keep all our due diligence intact as well. And yeah,
Okay. Okay. Well, I think you had a very interesting conversation today. Uh, I guess we're about to close. I'll just ask one last question. Um, where like let's say if you have some kind of a magical power, right, to fix Philippine healthcare, right? And this doesn't have to be on this topic, by the way. Just a
okay.
high level. What are you gonna do with this magic power? Like let's say you can fix one thing in Philippines with this magical power. What are you gonna do in healthcare?
That's that's a tough question. There's so much to fix, but at the same
Yeah.
time, what encompasses everything? Like, what's the big solution that will help?
Hmm. There's one thing that comes to your mind.
I still believe in universal healthcare.
Sorry, what?
I still believe in universal healthcare.
Yeah, you believe in
Uh,
universal healthcare, but what do you want to fix about the universal healthcare?
um, oh, that is such a tough question. I'm sorry. There's just so much. But of course, first comes to mind is cost, right?
Cost. Okay.
There's so many things that could have been fixed if there's enough uh, of a safety net for everybody and universal care properly implemented can hopefully achieve that. And hopefully people will also stay in the Philippines to apply to the residency programs because specialists are still needed. And I guess this is hopefully my way of contributing to help the human resource problem in the Philippines.
Okay. Yeah. So I think that's a good to hear that. I'll be asking this to every participant, and one day I'm gonna put this into kind of a survey to see some interesting data. But again, Pauline, thank you very much for joining, and yeah, looking forward to I guess keeping in touch. And yeah, maybe next time I can invite you again for some other, I guess, based on this discussion, some other detailed topic we can have maybe another episode sometime. Yeah. And thank you
Okay,
very
thank
much.
you.
And yeah, I just want to tell the other participants thank you as well. Yeah.
Thank you so much for having me.
Okay. Take care. Bye bye.
Bye. Bye.